Relations and Development. I take this opportunity to introduce the participants to our organization, Indiaspora. Indiaspora is a not-for-profit organization started around 12 years ago from the United States by a group of eminent Indian diasporas with a mission to bring together impactful and distinguished Indian leaders from across the globe, from diverse backgrounds and professions, with one common goal of being force for good to the world. With a team of 15, Indiaspora has been successful in expanding to countries like UK, Canada, Australia, Singapore, UAE, France, and India, of course. Our country representatives functions in countries like Australia, Singapore, and UK. Indiaspora India entity got incorporated just a year back, but we have been functional for the last 2 years with a team of 5 strong people across cities like Delhi, Bombay, and Bangalore. We were successful in organizing Indiaspora Global Forum in 2022 and Indiaspora G20 in 2023 that witnessed 350 participants from 26 countries. I'm happy to introduce Mr. Rajan Navani, who will be our moderator for this event and who will take you through. But before that, I'd like to just give a small detail about the event and an introduction to Rajan. As a tribute to the theme of this year's Women's Day, to inspire inclusion, the topic From Silence to Strength has been chosen to amplify women's voice, recognizing their invaluable perspectives in shaping health policies and interventions. This initiative provides a platform for panelists to share their stories, insights, and solutions regarding health issues affecting women and countries with a focus on India. I'd like to introduce again our founding board member, Mr. Rajan Navani. Rajan Navani has been a strong supporter of Indiaspora and a guiding force since inception. Mr. Rajan will be our moderator for this event, and he is the chairman, founder, and the managing director of Jetline Group. He serves as a national president of Indian Digital Gaming Society and chairs various industry initiatives like CII, AI India shows. Mr. Navani's leadership extends internationally, contributing to forums like US-India Business Council, Singapore, India Strategy Dialogues. I would like to also take a quick time to introduce my colleagues here. I have Preeta D'Souza, who's our colleague from Bombay. I have Shrenya Malik, my colleague from Delhi. I have Manjula from Delhi again, and me from Bangalore. We will be soon joining Mr. Srikumar Nair, our India CEO, will soon be joining us and being a part of this event. Thank you for giving me this time to welcome you all. Over to Mr. Rajan to lead and moderate this wonderful panel.
Thank you, Nisha, and a very warm welcome to all of you. Good morning to those of you who are joining from India, and a very good evening to those who are joining from the US and other parts of the world. Well, this is the inaugural virtual event from India for Indiaspora, and I must congratulate Shri and the whole team in India for actually pulling this, beginning a journey in India that started between India and the diaspora 12 years ago. So congratulations to everyone at Indiaspora to do that. And what better way to do this than to do it on a subject and a topic that is, so relevant, and I think something that, I'm personally very, feel very, very strongly about. And it is really about, the journey of India's growth, the ability for India to achieve, its Viksit Bharat or the position of global leadership cannot happen without, the strength of the Indian woman, the strength of women around the world, actually working, for India. And I think, there could not be a better topic to kickstart a conversation, and that too in a month where Indiaspora celebrates March as the Women's History Month around the world. So I think it is a great, opportunity for us to discuss a topic, which I think is so relevant, and really encourage all of you to participate, in this conversation. Goal is to make it as conversational as possible. But to lead this conversation, we have two very outstanding panelists who have already joined us here, and one whose actually flight has got delayed, and she just pinged me a little while ago that as soon as she lands, she will join. But we do have with us Naghma Mulla. She is the CEO and director on the board of EdelGive Foundation, and I think over the last decade, she has driven the vision of EdelGive, strengthening its core principles of collaborative philanthropy, transforming it from a grant-making foundation. And I really love that, to a philanthropic asset management platform. And we'd love to understand, Naghma, this difference, because I think, philanthropy today has to become sustainable. It has to be something that we look to invest into, because there's so much you get out of. And really how we can apply that to, not only this area, but, many other areas that, concern women and of course, health. And thank you. And, welcome. In addition, she's also on the board of Goonj and many others. Esha Oberoi is our next panelist, and great to have you here with us, Esha, as well. You are also a healthcare leader and a tech pioneer, modernizing healthcare delivery. So I think, the entire difference in terms of conversation on how do we massify, many of the conversations that we're having, how do we leverage technology to democratize access to so many things that, we consider should be natural, is something we'd love to, go into with you. But I think you have always had a very innovative and strategic approach. And, there have been so many awards that you've been bestowed with, the 2021 Women's Agenda Leadership Award, amongst, so many others. And, a futuristic thinking. That's how I have, seen you in terms of, the different aspects that you have covered. And, as the CEO of AFEA Care Services, we look forward to understanding better with you how, a lot of these issues can get addressed. So thank you, and welcome, Naghma, welcome, Esha. And I think we are going to try and take this conversation, into different aspects. And maybe before, and Shobna Kamineni is our third speaker, who, as I mentioned, who's on a flight and will join us as she comes. But maybe to begin with, this topic is very interesting, right? On one side, it says silence to strength, and then you say amplifying voices, right? So this journey from silence to strength, right, is one that, is it something that, women typically encounter? Because, I'll tell you one thing, when one looks at a patriarchal society, and it's funny, because sometimes a lot of these things are taken for granted, right? And I really want to see, how your experiences have you experienced that yourself, when you work with other women or even family members and others, right? Do you really see this journey first having to break out from silence to strength, and then, amplifying voices in your individual journey? So this will also give a little introduction, to your background, maybe a couple of minutes each. Naghma, maybe you can start.
I love the way you began. So thank you. This is exactly how I think these conversations to begin, rather than just going what's wrong with with access to healthcare for women. So thank you for setting this beautiful context. And yes, I love the question, because see, the thing about patriarchy is, I don't think anyone intends to be patriarchal, or someone decides that, this morning I'm going to disrupt the lives of women in my circle, or make it tough for them. It's the beauty and the trauma of patriarchy is it's like air. We grow up in it, and so when we talk about silence and access for women, whether it's me personally, or women from more privileged societies, or women from many marginal societies, we have grown up with with three circles. One is a circle internally, where right from the beginning, we are kind of pedestalized a little bit for sacrifices. It is you eat last is a virtue. You eat less is a virtue. You can't eat before the husband or the child is eating is a virtue. So I'm just limiting it to just the healthcare So when that happens, or I have a headache, but I haven't told anyone, so that's brave. You know, these are very small things that from the very early ages are internalized as you know, making us better women and better servers of the ecosystem that is supposed to love us, and we love it. So it's very beautifully internalized. It's almost like concrete in our systems, and that's the first circle that's just inside us, where we truly believe that we need to be last in the list of priorities. The second is the family, the circle of family and neighborhoods and society, where again it is, you know, if you've sacrificed, you are again, it's good not to talk about these things that happen to everyone, whether you have menstrual pain or whether you're going through menopause or whether you have childbirth issues. Everyone's been having it, so why do you have it? So there is a bit of, and those who talk too much are complainers and, you know, have less tolerance. And the third is the structure, or the, you know, access to actual infrastructure of health, where government has policies. There are hospitals, there are healthcare centers. Now, even these centers have been centered around serving men, because that's the way it has happened. Even the medicines that are available in the market have been researched, you know, have been produced largely with research based on male research candidates. So these three levels ensure that by the time, you know, you're even saying that, no, I have a problem, you had to navigate 3-4 hurdles. So I think that's, I mean, I'm just going to pause here because this is the way the context needs to set.
No, you know, and you're so right? It's something, you know, in the end. And actually, if you go to see, like, when I think of myself as a man, you know, my creator was a woman all my life, for, you know, either whether it was for wealth, at least being Indian, you know, for wealth, or for, you know, education and knowledge, or, you know, power. I prayed to, you know, you were taught to pray to Lakshmi, Durga and Saraswati, you know, and you see that women are shaping your life right through from childhood. Everything you've learned to a large extent has come from that. You engage with that, and still somewhere, you know, these kinds of things, you know, happen, right? I mean, it's interesting, because I also have 2 daughters, and that's all I ever wanted, right? Because, you know, it's something that when you see it, you say this has to change, and you don't even know why it happened. But great, thanks for setting that context. And Esha, would love to understand your little perspective, maybe through some example of your growing years, or some experiences in life. Anyway, how you'd like to take this topic first.
Yeah, no, thank you. Thank you. I really appreciate that. I feel very humbled to be invited, because I'm coming from a completely different place, you know, having born in India, but then predominantly grew up in Australia. So obviously really appreciate that you want to hear from that vantage point. So very often I don't openly like to speak about these things, because I think, coming from, I guess, a point that you just made, Naghma, is like, you know, it's brave for us to ignore and almost think that these little nuances that are around us in our ecosystem, how we grow up, they don't exist. So coming to this talk today, I was reflecting back, and I was thinking, I'm so grateful to have the platform to say something around this topic, women and their voice, and how we strengthen our position in the world. And again, this is a mindset of mine. Anything negative that happens, I ignore it. I reduce it to the size of, you know, and I guess that's a lot to do with the success then that I've had and the business that I've built. I migrated here with my family when I was 7 years old and had a really tough schooling. So by the time that I was 24, I was already suicidal. So then, beyond any experience that I had from 24 to now in my 40s, where I've built 2 successful businesses, really came from a place of, well, whatever I get, whatever fronts me, I can deal with it. And so I come to this session today with really this mindset that we normalize so many things. Like, in my mind, as I've grown the business, I've experienced it. I've absolutely experienced, you know, being in a room with a male trying to position a product or a service, and just knowing and unknowingly that things didn't feel right, and where this conversation was leading, and how I was going to get this business in his mind versus mine. So yeah. really coming to this conversation, I guess the lens that I want to bring is that we normalize things. And I think the importance of a conversation like this is to create a new normal. So when we give and we bring more women child into the world, they don't think that's normal because there is discomfort in it, whether it's, you know, how we're perceived sexually or how we have to live with the stigma around menstruation, our sexual health, et cetera, et cetera. So yeah, I hope that's a little bit of an introduction on my upbringing and where I come from.
No, that's very inspiring, Esha, and I must say, so the first question that comes to my mind is where did you get that strength from? I mean, I think because that is something, we need to, if we ever want to see this change, we have to find more people empowered. Of course, being inspired by your journeys is definitely one, but what's the source of that strength?
So I think the source of the strength that came when I started my first business, I was 24 years old. It came from a place of there's nothing beyond that. I can't get lower in my life beyond. It's like I have nothing to lose. To be honest, I really think that was my original source of strength. As I've evolved, and I think, this is a lot of this conversation today is going to be really evolving our beliefs and our own beliefs, so then we can help bring a better generation and create a better environment for our daughters. Now my strength is very different. Now my strength is I want to bring forth those experiences that were trauma on trauma on trauma. How does that help people like children and our women child that we bring into the world? How do we let them know that things are not normal, things can be better for them, and have that equal platform? And really, I think that's what it is, like creating that equality that we don't see. I think what you said earlier is so true. Whilst it is our mothers that bring us, and I'm now talking from a male perspective, why is it that there are still those differences, whether it's in the education system or in the health system or in our government, that we still have these differences that we need to clear up?
Yeah, I think we don't have enough conversations, right? Because it becomes very accepting, and I think therefore a conversation like this is so important and so critical, because maybe we'll find that a lot of these things might be able to be changed far better today, with so much more awareness, better levels of education. I think even it's also got to do with so many factors, that we said. But I really liked your point that, I think this is true strength, right? That comes from the lowest point. And you see so many inspiring stories, men and women, right? That sometimes you have to be pushed to really realize how much strength and power you have. And I truly believe in countries like India and, especially so many others where there is a very large number of people or women who live below the poverty line. Their circumstances really sometimes should push them to be able to take, stronger action, but it just still becomes, more accepting. And of course, we'll cover all those subjects, as we go into this conversation. But Naghma, maybe to begin with you, so how do we break this, silence and stigma? How do we get women to feel more empowered to seek, necessary care, support, specifically, as you said, when it comes to menstrual health, reproductive issues, or other things? How do we get women to actually break the stigma?
So, yeah, I mean, I wish it was really simple, but what I think is a must-have is more conversations, and more conversations in homes. See, the fact is, again, once I started working in the development sector and started meeting women, I also realized that a lot of these problems are not limited to the most marginalized. There is silence even in very privileged homes. For example, a mother in an average home, a regular income home, will not be talking about menstruation at all to her growing boys. Now, in a lot of cases, still even 10 years ago, men would realize there's something like menstruation when they got married. Now, and then they would think my mother was the bravest woman on earth, and why is my wife or my office colleague, acting, she's got no strength. My mother had so much strength, So then So see, what are we perpetuating? One is we're making life difficult for the woman. We're making life difficult for the man, because you can't suddenly tell him at age 25 that he needs to develop empathy, where he had zero context. So I think a lot of problems get solved, or at least begin to get addressed, when we start speaking of them in our homes. And I like to call it the dinner table, impact. That what happens every night on the dinner table has a very, very deep impact on the woman's life. Who's eating when, what, how is the dinner table being laid, how is it being, cleaned, everything, because that sets the parity in the house. And what are we talking on the one time when the family is together, what are we really sharing? And at that time, talking about her ill health, talking about the fact she needs attention, talking about, her unique issues is a must, instead of hiding it from the male members. Second is, it becomes both the male and the senior women in the family's responsibility, that when she's in distress, to get her access to healthcare. Now, in the most marginalized families, that is a privilege that is not had. Men don't get good access, and women don't get access even more. So only about 30% of the most marginalized population gets any access to healthcare. When they go there, they don't have female attendants, so they're not able to articulate what their real problem is. And if they are able to do that, then they don't have the access to the medicines that are then given. So there is like I said, there's a self, there's a family, and there's a structure. To break anything at all, first we have to talk. And then we have to have people who receive that information to act.
Yeah, no, I think, these are all very, very important things. And I think also for the women themselves, right? I mean, educating them better about their own health, for them giving knowledge from, far better levels. It's, of course, one side, the men and others, is also, I think, a big gap, that we see. And sometimes they don't seek it beyond the point. I don't know, but it seems like, when you look at a lot of reports and studies, it says, and cultural issues are really at the core, of so much of this. So I don't know, Esha, if you have some thoughts on, how can these cultural taboos, right? I mean, it's a lot of these are, put as taboos, or they are, put in as different things, how do we change it? How do we promote awareness? What can we do about education when it comes to, things like sexual health and so many other issues, which, it also leads to, say, cervical cancer. There are so many, educative interventions that I think get missed because of this cultural issue that Naghma just pointed out.
Yeah, I really want to reinforce the idea of it needs to begin at the family level and at the senior women at home being comfortable. And I think that it is not going to be an easy way forward. How do we change this discomfort that we've created over generations and generations? It's in our DNA, it's in our lineage, that these conversations are taboo at home. But again, that, one person in the household finding the strength to bring up the conversation. I actually tapped a few of my cousins around this and their experience, because they've grown up in India, and I wanted to hear from them what it's like growing up at home about these conversations, and they said it's non-existent. So a lot of my younger cousins that are in their now early 20s received all their sex education from the internet. Now, what's really scary about that is, think 5 years, 8 years, 10 years, when AI starts to really infiltrate our lives, that knowledge is going to be so distorted. So if we're relying on these external sources, a family in our household is the place of the highest levels of trust. And if we can't have these conversations in the most trustful, what we perceive as the most peaceful and trustful environment and a safe space, then how do we make good judgments outside of our household? I think that's what the message that needs to go. And then I again lean back on my own experience. When I started menstruating, it was, here's a pad, this is going to happen once a month. There was no conversation. And no disrespect to my mum, but this is a cultural thing. I grew up in Australia, but I bring that culture here, right? And we haven't changed much in terms of how stuck we are in our views around health. So I think the first and foremost, it's a responsibility within the house. I don't think that we can deflect that. And then I think there's that responsibility that comes in from government and education and really introducing those sex education programs in schools. So I understand that there's still many states in India that have banned sex education, and then there are some that have now started to introduce the good touch, bad touch concepts. So it's a way forward, but I think we've got a long, long way to go. And then this, of course, brings up all of the ideas of if boys have an understanding of what a woman goes through or her body right at the early age, then we stop a lot of the other issues like unplanned pregnancies, rape, the whole rape culture, etc.
Yeah, no, I think, imagine this, we are having conversations with people, educated families, tier 1, tier 2 cities, and sometimes when you go where the cultural taboos are much stronger, in rural India, villages, because, the larger cultural issues like this and patriarchy also gets more enforced because of lack of, probably lack of uh, education that is empowering, or, things like that. I think it gets worse, and it reflects in our data, right? Like if you see the 70% of adolescent females in India, face anemia due to poor nutrition. I mean, let's just take that one data, right? Because we do not have toilets, and for women to defecate, or to urinate, they have to go only when it's dark. Their eating habits change, their drinking water. I mean, just simple habits change that affects not only their generation, but also, the next generation. And I think, like something like nutrition or, food, etc., which also are very strong indicators of women health, are things I think that can be addressed. I mean, I know there are government programs that do it, there are fortification programs, or, community-based interventions. And I know a lot of corporate India, and, you, Naghma, might also be looking at, public-private partnerships to see how we can do, a lot more of that. But, maybe your perspective, Naghma, on, how do we really look at, this issue specifically for a country like India, and what can, we collectively do, right? Is there a larger role for women to play? Like, I think one thing that has come across very strongly is the senior women in families and others who have to change because they got treated in some way. They should change it for the next generation, and maybe this generation changes it for the next. So that generational change in women's attitude is definitely a very strong, message that they've got. But what else can we do when it comes to health, particularly from a nutrition aspect?
Yeah. So, ideally the senior matriarch has to play the role. But we also see, especially in the marginalized setup, that the senior matriarch is patriarchal too. So she becomes the agent to enforce what has been happening for ages. I think in these setups, what works, and I'm glad you talked about, open defecation as well. Women are brilliant when they collectivize. When they come together, there are in India, one of the biggest successes in the Indian development story has been the self-help group models. Where women are brought together and they're able to generate income and they're having some agency over their income. So one is, as soon as women have some money in their own hands, even if it is, a large part of it is taken away, there is agency, and then there is a little confidence that, I can make some decisions. And when it happens in a group, then she doesn't feel isolated or alone, and she doesn't feel I'm the only one who's going to be bearing the repercussions or the consequences of standing out or rebelling in some form or fashion. So tapping into these collective groups where women shoulder each other's pain and responsibility becomes important. What are we enabling them for apart from simple income generation? For example, if like open defecation, if I also tell you why open defecation in rural areas doesn't end, is because these women also find that it is that time when they go out collectively together, they are allowed to go out collectively together, which they're not allowed. So they're not allowed to go to have fun or to chat with each other. They're allowed to go out to relieve themselves together. So they actually enjoy this time out in the open. Now, it's wrong at many levels, but can we use that collective time to actually talk about better sanitary napkins, needing to eat something every day, ensuring that the girl child in the family is fed in a certain way? I think that is what the development sector aims to do, and that happens in many cases. government literature that is there, these health centers that are created everywhere, the the ashas that are there everywhere. These are infrastructural and group efforts that can take us a long way. So I think tapping into the collective power of a woman. Younger women, I think, are the hope for the future. While we hope that the elder women will participate, I think that elder women should, but they end up being being more activist for the patriarchal system rather than helping break open the new system. So it's going to be the responsibility of the younger women across all classes to kind of break open, the way Esha was saying.
Yeah, no, I think that is also a very, very strong point, because not only do they think about it differently, but they will also probably leverage on this community piece of what has worked with older generations. But are we doing enough, Naghma? Is enough happening in this space? What can be done? Do we have a concrete thing that we can do collectively more together? While government is trying in its own way, and private sector, because you're large part of this, the NGO sector that's doing. What can be done? Anything specific?
We need the men. We need the men now. And like women have been feeling a lot. They've been coming together. There's definite improvement in opportunities that are there in the modern world because of technology and because of just information access. But I think that is why it becomes very important on how we are raising boys in the same family. What information are we exposing them to much earlier compared to how our fathers and our grandfathers were exposed to? How it all boils down to the family unit. So even the power of a collectivized women's group gets energy manyfold and gets power manyfold when the men join them. So for somewhere we'll also have to ensure that everything that we do has pathways to the male members of the family who will obviously resist, because I don't even think there is a villain in this story. We are all victims of a certain kind of society. But to break open, while women may have all the energy and the willpower and XYZ, this needs men, and it will just take a few good men, and then work can begin.
I think message to you, Nisha, and everyone at Indiaspora. I think the next session we got to get a commitment from men, right? We've had a discussion on the issues from women, but the commitment to act or the call to action needs to be led, and maybe we should have a session or some format to see what that can be. Because I think what Naghma is and Esha, they're making a very, very important point, right? It has to, I don't know, but I'm born on International Women's Day. So that, I naturally use that as my leverage to say, and I don't know whether International Women's Day came first or I was born first, right? So I feel it is somewhere in me that I need to, these are issues that need to get resolved. It comes from within. And, we have a platform called Ek Women, which is giving voices to women in the US, South Asian, and we're doing a lot of other things initially to bring about a conversation to touch society at large, right? Men and women, that listen, this is something that in today's day and age, right, where we have so much technology. Today we are, the latest, I was seeing this movie yesterday where the AI, the woman is an AI, robot, and, it's everything of life is already happening. We're already moving to that generation where, as humans, these genders and multiple genders, so much is happening, and somewhere we are still stuck on a topic like this. I think it's something that we have to, as society, get beyond. And I think Indiaspora is committed, and now I can see Shri there, and he's already got his next job, his next India conversation going with men on this subject, and their commitment, Shri, to make things happen. But moving to technology and innovation, and I think Esha, you are one of those people we look to, right? Because technology has to solve for multiple issues, right? One, I think another issue a lot to do with women's healthcare is just accessibility, affordability, in countries like India. So how are you seeing technology, shaping that? And of course, technology also to ensure that there is larger levels of wellness, rather than curative capabilities trying to, come to the fore. Any thoughts around that, or something that you're seeing as a trend, or things that we can do more together around?
Yeah, you make a really good point. Where is the preventative care and the wellness approach and that holistic care, as opposed to spending so much? And we do, I think we look at the global GDP where we have less than something like 8% of funding across the world that we spend in preventative care. So there's a huge piece around that and work that we can do and then leverage technology. But there was something that Naghma, you really, when you were speaking about the family unit, that I just want to extend on is, these communities of women, and especially in rural and regional India, and that group strength that they get, I think, leveraging that, but almost giving our girl child permission to have a goal outside of marriage. Till now, I constantly hear in my family, my extended family, and I am certain that this happens in rural India, your destiny is marriage, your milestone is marriage. And I think until that changes and that goal changes, there's no motivation for a woman, because she can see the trajectory. So I think, when you think about the financial decisions at home and where we prioritize then our health and well-being, or when we spend on medication or issues, it's really the individual with the purse strings at home that makes the final decision. The final decision will be the person holding the purse strings. And I can say that with a lot of confidence because I don't have guilt when I book in a health checkup for myself. I don't have guilt when I prioritize things like yoga or meditation or wellness, because I contribute financially to the family. And so, I mean, I when you were speaking, Naghma, about, the community, I was really thinking like how, and then again, this links to, well, do we leverage technology even before we get to diagnosis and things like that around tech? Can we use technology for financial literacy, and does financial literacy come in as like a priority for women, so they can feel confident in contributing? And it's not to force women and everyone needs to get into the workforce. I think right now we're doing pretty well. We've come to like 37% of females are now in the workforce in India. So we've made, even in the last decade, we were 10% to 40%. There is progress, but I think it's just having the decision, the ability to make a decision that I have the knowledge and I can get a job if I want to. I can contribute financially if I want to. To your point around technology, the way that I see tech, and I'm very invested in it. In fact, it's something that's kind of underpinned the success of the healthcare businesses that we have here in Australia. Technology, to a huge degree right now, we've been using very much in the reactive space. And then being able to deliver care. If you think about automation in logistics and, getting resources out for service and care delivery. And the way that I'm really starting to shift my focus after more than a decade in business is now really thinking about how do we use it more in the preventative space. So early intervention, diagnostic tools, etc. That is a really exciting space to be able to use tech. And then I guess the only forewarning of that is, the data that we feed into these AI models are only as good as the data that we feed them. And if all that data is coming from generally, globally speaking, white men, then the diagnostics that these AI tools make will be amplified, biased, and they're just going to amplify a problem that we already have right now on a human level without the technology.
No, that's a big conversation, we are having with governments as well, because, when we say citizen data from India, for example, cannot be shared, globally, especially when it comes to advancements in medical research and, things like that. I mean, a large part of the innovation will happen without that data, right? And I think these are challenges, right? I think somewhere, policymakers, governments need to balance that, thing. This is just one small issue there, but what you're saying also, where is that access available, right? How does one really, cater to a generation which is probably of spenders on healthcare? We're not going to spend as much as probably what the West is spending today. So, what's the point in creating solutions that will address those, those areas of health? I mean, there are multiple reasons, as we know, that drive, different things. But it brings me to a question and a subject. I think is there political will around the world? I mean, again, right, we see, you talked of more women in the workforce, yes, but some data in India showed that thanks to the pandemic, right, a lot of them actually moved out and now are struggling to come back, right, especially the way it impacted in tier 2, tier 3 cities and in many other areas. So I think, yes, while we are seeing progress on many of these fronts, leadership positions, right, even today, whether it's the US, whether it's India, women in leadership positions, is there enough of that happening, right? Will that, right, change the way, political will be driven by that, when women actually come into positions of leadership and power where they're equal with men? I have sometimes found they don't want to talk about women's issues because, they say otherwise we wouldn't be here, and it kind of makes them look weak. I don't know, but so these are also, in a way, stigmas. If this problem is genuine and it needs to get resolved, right, or we need to find ways. I don't know if you have any thought, Esha, and then maybe Naghma, on this subject.
Yeah, sure. I mean, let's consider just the abortion law, right? So in 1970, we legalized abortion in India, but 80% of all abortions are still done in unsafe environments with untrained practitioners, leading to millions of women that end up dying through that process. So if we look at then the finer details of that law and the conditions that come with it, you need to have been raped. You need to then prove that you were raped. You need to, you need to prove that this is going to lead in physical impairment or lifelong disability, mental or physical. 2 doctors need to verify it if now you're beyond 26 weeks for that abortion to be legalized. Something like less than 20% of women are in the political leadership roles in India. So we need to have more change, and it needs to start in the leadership roles. Absolutely, because that's when we get into the detail of whether we bring in these laws and are they effective, because clearly some of them are not. And we can see that with the continued statistics that are incredibly distressing.
Yeah. Naghma, your thoughts around some areas of policy, government as stakeholders in this journey? What do you think we can do more or they can do more?
No, I agree with everything Esha said, and I have more. One is that the women in workforce have reduced in India. Informal workforce, they're now, I think, 18 or 19% compared to 30 years ago, where they were about 27, 29%. So that also is happens because typically we've seen in the average Indian family that when affluence increases, women are asked to take rest, or women find it women's income is considered as disposable income, which is not needed when the family income is increasing. So women are encouraged to leave workforce, and India is the only country in the world where women leave workforce for a reason, that is, my child is in the 10th standard. So that is a real thing.
I think you've proven my point about good conversation versus the internet.
Yes, absolutely. Absolutely.
You knew there was going to be some flaw if you're going to get an Australian talking. I'm trying my best.
No, Esha. I'm saying I agree with everything you're saying.
Except that particular statistic.
That statistic, but I'm also coming to the informal sector. What I've talked about is only the formal. In the informal sector, we don't have a clue how many women are there because they're not even counted. All right. So from whatever we know, women are there everywhere, in farms, at homes. They are just working from morning to night. They have 15, 16-hour days, and they are unpaid, uncounted. So they are zero in our statistics. So I was actually building onto that. We have a problem that affluence leads to women dropping off workforce. We have a problem that depravity actually ensures they're there and they're not even counted. So a woman who's not counted will not get any access. She will not be considered as a legit member of the family. She will not be spent on. Government will not know that she needs access to information. That's an uncounted. So there's the invisibilized women workforce, which is I was coming to. So that's like very high and absolutely invisible. in the corporate India, 500 of the top NSE listed companies, only 27 have women leaders on them, only 5 have women MDs, right? So that's the status of women in leadership in India. And you're right on the political scenario as well, but I think one, we need more women leaders, which we are clearly not getting. The system is too rigged against them. But the only thing that I would say is a beacon of hope is that women have started voting in large numbers. And when women become the voting bank, then a government also takes notice. Like the last 2 years have been very high on the leadership. Like the PM has announced that women need to be educated, women need to get access to income. Now, when that comes from the top, it does have a trickle-down effect, which in the beginning may be more tokenism, but society listens to a leader that they idolize. So all of these are true all at the same time. And India is that place where strange dichotomies exist together. But it's important to address that when we talk of a woman and access to healthcare, there is no one woman in this country. This woman has, because of caste, class, and the situation of her marginalization has very different contexts, and where she sits determines what access she gets. So we need more women leaders. We need women to vote so that their voices are heard. We need governments to take notice. But in all families, we need men and women to come together to decide that our children will not do what we did.
I think that's a powerful ending, but talking about health with women, we cannot not talk about mental health. Oh, there it goes. I think someone's also raised that as a question now. I mean, you just talked about so many things, right? Women do, and there's no acknowledgement, or, under the garb of sacrifice, or, different words that, roles people do, or the challenges of dealing with so many things. And I think data and statistics clearly show that women are disproportionately affected by mental health issues. Yet, the access to mental health care, even destigmatizing, some of these subjects are hard. And even in the workplace, right, we see, we're trying to promote emotional wellness and deal with these issues, but these are hard challenges, to overcome. Any thoughts around, around that, Naghma, and then maybe Esha again? Yeah.
The one thing COVID has done, which is positive, is that it has put the spotlight on mental health of people who faced, in immense trauma in a very limited number of years, and the backlog of mental health issues that will start coming up. So that's been a big win, I think, in terms of us even talking about mental health, because why women, even men, had no access to mental health, honestly. We have a taboo. Our society has a taboo that if we've asked for help, we are losing it, or we are too weak. So that's important. The importance, again, of making this a common conversation in our offices and in our homes. More mental health, doctors, more access to mental health that is easy and without taboo, more social networks that are, that have a venting space, a safe venting space for women, extremely important. Women have been holding, women's bodies are like hosts to mental health issues. Whatever they don't externalize, they internalize. And we also see that autoimmune diseases are so high in women because of this unaddressed mental health. There's a very direct correlation between a woman who's gone through, decades of trauma and the kind of diseases that she becomes victim to. So I think conversations at workplace and home, more healthcare facilities where mental health is given an institutionalized support that is there, and I think government policies around this also will be very helpful.
Do you see more of that in Australia, more focus given to areas like that, Esha? Any thoughts that you have? Also, how do we, create a better work-life balance and, things like that for women who are working? Any thoughts around this subject?
Yeah, I think given the dialogue today, it's no surprise that we land up on mental health as being, a key health condition with women and men, but certainly from what I understand, women more so. I think there's a lot of opportunity. In Australia, it's much more open. It's certainly, there's a lot more empathy around around mental health, but that's also been post-COVID. So I think there was an acceleration of what we can do and how we respond to mental health in the workplace. And that was post-COVID. I think, I mean, I love everything that India has to offer when it comes to mental health. I think we're rooted in, you know, it's in our, I'm so proud of the fact that the Western world is adopting yoga, meditation, and Ayurveda. These are the things that, you know, will bring the balance that we want and the harmony that we want in our mind and body. I absolutely believe, and again, I think fundamentally it goes back to the leaders of the organizations that are building these businesses to be empathetic and have a dialogue around work-life balance. We lead by example, we prioritize self-care, and then that's how people in the business feel comfortable to have that. And I mean, so AFEA Care Services, we're a healthcare provider in Australia. We're 3 years best places to work in Australia and New Zealand. And our category and our sort of excellence in being a best place to work has fundamentally been on psychosocial safety, and that we've created in the business. So we've always been recognized for that. And I think that goes a lot to the fact that myself and the other leaders in the business, we prioritize our self-care and our mental health. And so then it allows for other people to feel comfortable with it and talking about it and dealing with it, because that's the other thing, is when we're suppressing it, it only gets worse.
No, I think, you know, at the workplace is a great place to bring about, you know, things like that. I mean, we run India's leading mindfulness platform. It's called thinkright.me, where, you know, we handhold a person's journey from the morning and an affirmation led, because everything that you say or do emanates from thought. So you get better control on your speech and action if you, you know, get your thought right. And at 5 a.m., you won't get angry. Affirmation, meditation less, you know, very mindful way of doing things that definitely enables, you know, the strengthening of the mind and helps prevent, you know, issues around mental health. That, of course, is one big shift, as I agree with you, which India has and the world is also adopting post-COVID. But, you know, for those who are already affected, right, or where the situation is really, you know, far worse, I think we need to, again, you know, I don't think it is an individual role for government or any one government or, you know, businesses to play. It's also, I think, a lot in the civil society. We need, you know, NGOs and others also to collectively come together, because I think this is also an unnoticed, you know, and unaccepted stigma that you know, people and especially women have. But no, I think we've had great conversation around multiple subjects and we don't have much time, but I'm going to just try and get a few questions from you know, people who are listening in, and maybe, you know, either one of you could answer it. The first one is perhaps giving both the genders an overall understanding of the health journey that a woman undergoes during her life stages could preclude a number of issues. That effort hasn't happened even for women themselves. We need to map and disseminate, you know, that information. I think Arun has raised this point. I think it's more a suggestion, but any ideas on how we can disseminate more information? Have you seen some of that happen? Again, you know, something that is addressing both the genders. It's interesting, right? I mean, that's one conversation we've had today. The role played is probably more significant by the male, but, you know, how do we also address information is meant for both genders? Any thoughts?
So from my vantage point, it happens in the development sector. There are some grassroots organizations that actually develop this material. They have conversations with girl circles. They have conversation with, you know, young men and boys, and that so there are interventions at that level where safe touch, from safe touch to menstruation to, you know, men understanding what women are going through. That work happens at the more grassroots level. I feel we don't actually do it in the more informed societies, you know, or the more that conversation between boys and girls is almost, you know, like you, Rajan, I have teenage boys, two teenage boys. And I can safely say that the conversations are very spirited, but very superficial, because there is no serious content that they have access to. They're all kind of fumbling, trying to understand each other, half from social media and half from these conversations. But there is, if I may, and I mean, maybe it's a wrong word, a little adult intervention, not from an interventions perspective, but also from grounding, from how are we informing our young children who are the adults of the future, and that's where I feel mothers become very, very critical to this. Having a safe place where your boy or your girl can come home and ask questions that they cannot probably ask anywhere else, is extremely. So how are we that safe parent for our children? I think that's a very important question, and that can address many problems, challenges.
No, I think that's very, very, very important. And also, I think as Arun has also pointed out, more mainstreaming it in education, making it important part of our curriculum. I think that's also something
Even today they are
that
flipping.
can enhance this. Yeah.
Even today they are passing on those pages and saying, it's not in, this will not come in the exam,
Yeah.
so flip the.
Yeah.
That used to happen when we were
Yeah.
children. It's still happening.
Yeah, it's crazy, right? I mean, how like decades later, you see that same trend in your young
So
ones, and you want to change it because the world around has changed so much, right? I mean, and somewhere some of these practices that we see in education around the garb of tradition, and we want to, we want that, but that is okay from a discipline, many other aspects, but we miss out on the content piece and its applicability, to the real world. And I think there's another question, and maybe Esha, you can take this, is like, considering the cultural dynamics of childcare responsibilities, how do we create a better work-life balance for parents? One of the suggestions is that, corporates and companies need to ensure that they have reliable childcare facilities at work. Any thoughts you have around that? Because it also links around to role of parents, children, and I think that beginning of this conversation, right? Somewhere we are coming back to that family unit where it all starts, whether it's a male or a female, and those, few most impressionable years as a child actually sets up a lot of conditioning and behaviors for later, right? I mean, comes back to that, right? And I think parents being able to spend time with their children correctly is such an important piece of that. And again, enlightened parents, so all of these need to fall into place for us to see at least things change in the next generation. But your closing comments on this, Esha?
Yeah, no, absolutely. I agree with the comments there. And I think that businesses can do a lot more if there's opportunities for businesses to have the facilities within the buildings, or partnerships with childcare centres to be able to promote the women workforce and encourage them to use those facilities. And then I think in addition to that, we've had some really positive lessons from COVID, and one of them is workplace flexibility. So leveraging technology, being able to fundamentally just use the remote hybrid working to better continue to, retain women in the workforce is absolutely essential. And I think that the responsibility of that relationship between mother and child only gets more and more intense as your children are older. But initially it is that physical presence, and then later on it's more emotional. So just being able to cater to that and be on the journey with the mothers. If we want them in our workforce, if we want them to end up in leadership roles, we need to be mindful that we're not losing them at the critical phases of life.
No, I thank you. I think any last comment from you, Naghma, because we kind of run out of time, but it's definitely been a very enriching conversation.
No, it's been a beautiful conversation, because honestly, when I was invited, when I came in, I thought we'll be delving a lot into the technical aspect of healthcare and all. But I think this is more important, because as a society and as people, really, there is so much that we need to understand, about how unconsciously we are participating in a certain ecosystem, So this conversation has actually made my day, and I would really thank Esha, for her beautiful comments, and you, because I think you kind of drew us into having a much more meaningful dialogue beyond statistics, really. So I would
No,
just
no,
leave it.
Naghma, it's always a pleasure chatting with two strong women, who have become stronger as they've grown up and in a society that is really not very easy, to see those examples happen. And I think both of you have shared your journeys, your thoughts. And in diaspora is really about what you just said. It's about people to people connect. At the end of the day, if you look at our Indian diaspora, right, around the world, we've become part. I mean, we have Esha here and so many of others, we have family, have integrated into societies, had an impact. And, the ability for us to take these conversations now, as India is moving with tremendous strength into the next, 25 years of its journey, where we say India will be center stage in the world. I think it's only important for us to not only be part of these conversations, but to provide thought leadership, I think, to lead the change in society. And, somewhere we want to see these dialogues, these conversations that we can spur, as Indiaspora to lead to that action. So hopefully in the coming years, we'll read something about both of you doing something that is marginally changed, what we've discussed today in your own way. But again, thank you so much for, sharing your time, being with us and having this conversation. And I'm going to give the last word to Shri, who joined us late, but, he's the CEO for Indiaspora in India and has now built this community in India, through a lot of sweat and blood, talking to a number of people and stakeholders. And, while we went around the world and built the diaspora, I think finally the connect with India is what will strengthen, us for the future. So thank you. And over to you, Shri, to close up this conversation.
Thank you so much, Rajan. Thank you, Naghma. Thank you, Esha. I think terrific conversation. I missed the initial part of it, but I think I was just lucky enough to get into the session 10 minutes later. So I think I did catch the better part of everything. I mean, we at Indiaspora gives a lot of importance and emphasis on women's issues, and we'll continue this dialogue. I mean, we'll continue this dialogue. We want to get in policy experts. We want to get some educationists, counselors, also to give their views. Unfortunately, Shobna couldn't join us. Her flight got delayed, but I think her perspective would have been also very important and to guide us further what to do. But like Rajan said, we have a task at hand, and we'll continue to, highlight this issue. We'll continue to keep doing these dialogues as we progress through the year. Thank you again, and thank you for a wonderful, terrific conversation. It was amazing. I really loved it. Like Naghma, you said, I wasn't expecting this to be a generalistic kind of thing. I thought it'll be more technical also, but this was fantastic. Rajan, thank you for steering this that way. Wonderful. And thank you, Esha. Thank you again.
Thank you.
All the best
Thank you,
to
everyone.
everyone. Thank you, everyone who joined. I'm sure that you all found this engaging and really useful. Thank you.
Thank you. Thank you.
Thank you, everyone.
Bye-bye.
Bye.